From high atop Healthcare Hill in Central Maryland, this is BSN Headline News. Today's top story is Bon Secours Health System again leads the crowd as a champion of coverage for Americans everywhere. In a press release from the U.S. Department of Health and Human Services dated September 30th, 2013, Bon Secours Health System is recognized as a champion of coverage. What is a champion of coverage? A champion of coverage is an organization or business that has volunteered to help Americans without affordable insurance learn more and get coverage through the health insurance marketplace. So, what's the health insurance marketplace? Simply put, the health insurance marketplace is a process set up by the Department of Health and Human Services that provides everyone with a new way to find health coverage that fits their budget and meets their needs if they have no other resource for health insurance. According to Kathleen Sebelius, Secretary of Health and Human Services, Champions of Coverage is a network of volunteers on the ground in every state, healthcare providers, business leaders, faith leaders, community groups, advocates, and local elected officials that can help spread the word and encourage their neighbors to get enrolled. And as a champion of coverage, Bon Secours Health System will assist thousands of Americans who do not have health insurance coverage find health insurance coverage. Champions of coverage include national and local businesses and organizations like bloggers, community health centers, hospitals, communities of faith, and civic organizations. They will use publicly available materials from the Centers for Medicare and Medicaid Services, both digital and in print, to help members of their communities understand their new options through the marketplace. Indeed, there are many ways these organizations are helping, including providing information about the law in their office, hosting education events, or posting information on their website. And Bon Secours is in good company with other organizations that have joined efforts to get more Americans affordable health insurance. Organizations like the American Academy of Family Physicians, the American Nurses Association, Men's Health Network, the National Women's Law Center, Lutheran Services in America, and Thrifty White Pharmacy, just to name a few. To take advantage of the new online health insurance marketplace, millions of uninsured Americans need to know about it and how to sign up. Bon Secours Health System has embraced this effort and became a champion of coverage. To find out more, visit healthcare.gov or like HHA on Facebook or follow HHS on Twitter at HHSGov. In other news, from time to time we here at BSN Headline News like to take a look at relationships, as in right relationships. But what do we mean when we say right relationships? And what are right relationship behaviors? Well, regardless of whether you are an office worker, a clinician, or a leader, whether you are working with patients, the general public, or fellow workers, what we do and how we treat others reflects on us individually and as an organization. Right relationships behaviors are simply some practical guidelines for how we treat others and how we expect to be treated. Right relationship behaviors break down into three distinct categories: honesty, engagement, and accountability. Under right relationships behaviors, we agree to be honest, which means we speak to rather than about each other. We speak our truth without blame or judgment, and we express both support and differences of opinion with the goal of achieving understanding and reaching consensus. We agree to be engaged, which means that we will show up, be on time, and manage distractions. We will listen deeply, ask questions, and provide feedback, and we will ask for and extend forgiveness. We agree to be accountable, which means that we may not reach consensus, but leave as a team. We will do what we commit to do, and we will support decisions after meetings. As we move out of the fiscal year 2013 and into fiscal year 2014, let's reaffirm our right relationships behaviors, which we believe is an integral part of being good help to those in need. Finally, Bon Secours Hospital in Baltimore is in discussions with the Maryland Health Services Cost Review Commission to join the state's Total Patient Revenue Program, or TPR. The Total Patient Revenue Program is a pilot program for lump sum payments developed to give hospitals a financial incentive to manage their resources efficiently and effectively. The idea is to help slow the rate of increase in the cost of health care. Essentially, the Total Patient Revenue System pays hospitals a lump sum of revenue every year, regardless of how many patients are treated or how many services are provided. If the hospital is able to contain costs and manage health, it gets to keep all profits from the lump sum. However, the hospital has to absorb any costs beyond the lump sum amount. Now, naturally, hospitals would have an incentive to reduce length of stay, ancillary testing, unnecessary admissions and readmissions, as well as improve efficiency in providing services while treating patients in a manner consistent with appropriate, high-quality medical care. The program has been in effect since 2010, but has only been implemented in rural hospitals. Bon Secours Hospital in Baltimore would be the first urban hospital to participate in the program. Bon Secours Hospital in Baltimore, Maryland. We do like to be innovative. Well, that's it for this week. Stay tuned to this portal for future up-to-the-minute information on these and other stories on BSN Headline News. I'm Dave Schlachter. Thanks for joining us. BSN Headline News is a production of Bon Secours Productions and is solely responsible for its content.